So welcome back everyone to the second part of the all 200 questions recall session, and I have got almost 200 questions only for the recall session. Uh, According to the answers and feedbacks I got in my previous recall session, I will like to clarify my answer that for in a case of CAD, if the propanolone was in option in case of migraine, then it would be a better answer, I suppose, than the topiramate. Okay, I have searched it and I think the propanolol is the better option. Coming to today's recall session, starting from biochemistry. Alpha iduronidase deficiency, it is seen accumulation of heparin sulfate and dermatan sulfate. BCC with freckles, many times asked, this is a case of xeroderma pigmentosa, and it was also in my digital image bank. It is nucleotide excision repair. If anyone of you want my digital image bank or the previous year question of NEET PG and INICET, then it is given in the description box below. You can check them out. History of fractures, multiple petechia, it will be propyl hydroxylase deficiency. Means the enzyme activity is reduced in a case of scurvy. Patient with jaundice bleeding after vitamin K injection, it was normalized. So the probable cause is a deficiency in intrabiliary circulation. It is the biliary obstruction. Man trapped in tunnel for 5 days, ketosis will be the source of energy. Patient with high phenylalanine cofactor deficient is the tetrahydrobiopterin. It was in previous year NEET PG only, NEET PG 2024. Vitamin B12 deficiency, which will be deficient, is methionine. Hydroxychlorothiazide nutritional deficiency, neuropathy, tingling, heart failure. It is saying both dry and wet beriberi, so it is thiamine. Framesheet mutation outcome is complete change in protein production. Meningitis diagnostic technique is the multiplex PCR. Orange tonsil, it was also in my digital image bank. It is the Tangier's disease. Elevated total cholesterol, subcutaneous xanthoma triglyceride type 2A. 6-month old recurrent infection, ADA deficiency is seen in case of SCID. Neurodegeneration, hexoamidase A deficiency, cherry red spots, GM2 gangliosidosis. Phrynoderma, next step, ocular examination, because it is seen in case of vitamin A deficiency. So this year also 15 questions from biochemistry. As I predicted the marks weightage, only the pediatric weightage has been reduced and the questions have been added in OBGY. As I said that NEET PG marks distribution will be more or less the constant, so it was more or less the constant only. FMT, delusional person gets instruction to kill his colleague. He is telling this, so you have to confirm it by a psychiatric evaluation. POXO doesn't differentiate between children, so both male and female below 18 years comes under POXO Act. Rice watery stool seen in acute arsenic poisoning, which mimics the cholera. 16-year-old had consensual, but the consent is not valid. It is a case of statutory rape, so consent is invalid because the girl is below 18 years. Curved stretch mark and scratch mark and 3 croup bruises on left side of neck below the thyroid cartilage with hand throttling. Zasco phenomenon, so this is a new question, so I have marked with N. uh, it is the tendon reflex after the death, it is seen. 68-year breathlessness, all life prolonging measures are taken, ICU admission. So what you will do, as I saw that most faculties are telling that discharge and send for hospice because you can only do the palliative measures. Medicine, anti-role, as I have said, so it is a Jogren syndrome, means lymphocytic infiltration and destruction of salivary and lacrimal gland. Knee replacement dyspnea, most reliable test is it is a case of pulmonary embolism, so CTPA. AFib with mitral stenosis, hemodynamically stable, next best step is ventricular rate control. PSVT requires prophylaxis, it was said, not treatment. So a rate control agent, that is the verapamil. Osmotic demyelination syndrome, MRI head, it was also in my digital image bank. You have to do an MRI head. COVID-19 PaO2, FiO2 low, approximately 100 was there, and it is a case of ARDS. It was a previous year question only. low tidal volume, and high PEEP. Irregular pulse, no other comorbidity, verapamil is given in the treatment, and it was in the FMGE also. So PSVT prevention has been repeated once, so cut this. Salt craving, hyperkalemia, metabolic acidosis, skin pigmentation, it is a case of Addison's disease. DKA scenario, not used is the 3% saline, the hypertonic saline. As I told that DKA is a very much important topic and it came again. IVF causing hyperchloremic metabolic acidosis, so it is normal saline which had chlorine. Irregular pulse, right sided weakness, CT scan shows no hemorrhage, BP was in normal range, you can do IV thrombolysis. Next step, morning stiffness, and for CCP it was present, so it was a case of RA where you will see pannus formation. I hope this was in the option, or if any option related to the RA, it will be the answer. Hyperpigmentation in Addison's disease, what will be the test? So it will be ACTH. ABG analysis was given and it came to be acute metabolic acidosis. There is nothing called acute metabolic acidosis, but in the option it was given so. And the anion gap was 30. Blood glucose 2 to 3 times raised and maintained. What will be the insulin level? So it will rise at first due to the preformed insulin, then it will remain in the elevated level after that because of synthesis of new insulin. Coming to the surgery question, heavy weightage one. After RTA, normal CT, so and retraction balls are seen. DAI, diffuse axonal injury, this is directly from the FMG this year. Pode orange image, probably if it was involving lesser area, less than 1 quadrant, then it will be T4B or else T4D. Congenital diaphragmatic hernia image was given. Gold standard for achalasia cardia, you all know that it is manometry. Identify fistula according to Park's classification, it was intersphincteric. Burn, identify the procedure, it was hysterotomy. Surgeon's knot image was given. Varicose vein image, and what is not seen, so it is lipodermatosclerosis. PDS suture was given, what is true, so it is a monofilament suture. Dysuria, phimosis, and white color something was shown, so it is balanitis xerotica obliterans. Its definitive management is at first you will have to do the phimosis management, that is the circumcision. After that it usually resolves. If it does not resolve, then go for a dermatologist opinion. So balanitis xerotica obliterans is actually the lichen simplex atrophicus in the male patients, and in the childhood it occurs and it presents with features of phimosis only. Strasbourg's classification, it was a type A. Palpable gallbladder obstructive jaundice, Courvoisier law, as you all know that, so it is seen in case of carcinoma head of pancreas. Cancer, anal cancer, so inguinal lymph nodes are involved. Stab injury and unstable. In case of stab injury, if there is peritoneum breach, and as you can see that the patient is unstable also, so you have to go for exploratory laparotomy. Ureteric stone, best investigation is NCCT. Focal nodular hyperplasia image was given. You had to identify that. After total thyroidectomy, after 48 hours, what is the most common side effect that could be seen? That is the carpopedal spasm. It is in the, so you can get the post operative time period, that is 48 to 72 hours. It is in that range only. During surgery, surgeon accidentally injured a vessel located posterior to the epiploic foramen, so it is the IVC. GAC does not contain, this is an anatomy question, but previous day I didn't got the recall, so I am discussing it here. So the answer will be the vagus nerve. A wet gangrene image was given, so it is also a new pattern of question, and this wet gangrene has not been asked in previous year. Pediatrics, pretty low weightage this year, it was febrile seizure, so it will be diazepam. 7-month-old infant Katori, so you should have ideally left this question because this no one knows the correct answer. If you are preparing, only the pediatrics faculty know that. So it will be 1 Katori 3 times a day. As per Aditya sir, I had seen the video, so he specifically pointed out the guidelines that it is in the 6 to 8 months age, so it will be 3 times a day. CKD with bowing of legs, calcium supplementation and phosphate binding. Congenital hypothyroidism, you get the thyroid USG as normal gland but no uptake, so there is defective transport of iodine. OBGY, 21 to 25 days of cycle, low FSH, low LH, and estrogen, high progesterone in day 21 to 25. Image of controlled cord traction was shown. Cord prolapse scenario was given, so you do the elevate the presenting part, retrogradely fill the bladder and go for an emergency cesarean section. It is an emergency. Abnormal uterine bleeding, endometrial thickness 16 millimeter, perform endometrial biopsy. Loading dose of Pitchard's regimen, it is 14 mg. Atonic PPH, after medical management, you go for Bakri balloon catheter. All the methods that are in sequence, after that you go for Billing suture and all. In FMG, the question was in case of CS, it was given. So the topic is same, but the question was different. In case of CS, then you will go for the sutures, the Billing suture and all. Labor woman, fetal bradycardia, maternal tachycardia management is artificial rupture of membranes. 65-year-old woman, and the image of the specimen was given. It was probably an endometrial cancer, which corresponds with the age. CTG 1 acceleration in 20 minutes, most appropriate. Next step of management is repeat CTG for 40 minutes. Previous cesarean section, fetal bradycardia, maternal tachycardia, so you will go for a cesarean section. Shoulder dystocia, this is directly from the FMG. First was the Mac Roberts, and you can rule out all other option because there was no Mac Roberts in other option. Umbilical cord, one vein, two artery, this was a basic question from the NEET or the +2, you all remember this. Mediolateral episiotomy, how you close that. If you have gone to labor rooms and you have performed episiotomy with repair, then you will know the first hand experience. So it is at first the mucosa, then the muscle, then the skin. 30-year-old lady, and the imaging was showing adenomyosis in MRI. 62-year postpartum woman, history of hypertension, vaginal bleeding, BP was 170 by 110. Most appropriate next step of management was probably, if the BP was in this range, then you will go for a pap smear. Okay, and after that you manage. If the BP was more higher than that, then maybe you have to go for a medical management. But if it is 170 by 110, then you can go for the pap smear and all. 36-year-old female with high FSH, low AMH, so it will be a case of premature ovarian insufficiency. First ANC LMP was 2 months ago, so you measured the crown rump length, it is the best. Pituitary microadenoma cause decreased GnRH secretion from the hypothalamus. Hydrouretronephrosis, so it was stage 3B. Elderly woman, elevated CA 125, so it was serous cyst adenoma carcinoma. Serous cyst adenocarcinoma. Vaginal breech delivery, winging of scapula in the baby, probably it will be lopsided maneuver, not sure about this. Bluish cervix, linea nigra, probable signs of pregnancy, it was in FMGE also. DVT in prophylaxis of postnatal women, you give LMWH. Coming to the short subjects, muscle relaxant, histaminic side effects, maximum with the atracurium. The curonium, those don't have the histaminic side effects. Malignant hyperthermia, IV dantrolene. Needle cricothyroidotomy, so it must be followed by a formal tracheostomy. This was a controversial question, but I don't think it to be a controversial question, because in the question it was said that the patient was in a unresponsive state. In pediatric patient unresponsive state, you go for CPR. It was also in my digital image bank, so you go for the chest compressions. If the patient was responsive, then you will go for the Heimlich maneuver, that is the abdominal thrust. In infants, you go for the Heimlich maneuver of infants. All are given in my digital image bank. Psychiatry, tardive dyskinesia, and it was venvenazine, the answer. Amnesia, lost her father's 2 weeks back, so the time period is important, and having flashbacks, so it is a acute stress disorder. Perfectionist, many of us are perfectionist and we are suffering from OCPD. So the most common or the easiest personality disorder was given. The narcissistic and the OCPD are the easiest to diagnose, so it was only given directly from FMGE. Bizarre presentation, don't remember identity, move from the town. If there is moving, then it is a dissociative fugue. Visual hallucinations, God's direction, so it is a case of delusional perception. The perception is having delusional. Orthopedic spondylolisthesis was given. It was also in my digital image bank. 60-year-old patient frequent size of head change. So it is seen in case of either the Graves disease or in the Paget's disease. So ALP was also elevated. It is a case of Paget's disease. Mid-shaft fracture of tibia, pain disproportionate to the injury, stretch pain when there is stretch pain, and it is a case of compartment syndrome. And this is also a previous year question. You go for immediate fasciotomy. It is the emergency management. A male mid-shaft fracture of femur, petechial rash over the chest and the lower conjunctiva. So it is a case of fat embolism syndrome. 7-year-old child. So this is also a controversial question, but in the question it was said that 7-year-old child, not a 7-month-old child. So developmental dysplasia of hip, as the name suggests, it will present in the congenital age group only. The Otolani and the Barlow's test you do in case of DDH. So this, the image that was suggesting was also of that of Perthes disease, those who have done the digital image bank. So this was a case of Perthes disease. In eye was a bit pretty difficult, I will say. Means it was completely different and out of the league. Elderly patient, dandruff like deposits in anterior lens, slit lamp examination, pseudo exfoliative syndrome. Intact ring, this was a pretty easy one, keratoconus. 15-year-old patient, painless, gradual increasing lateral canthus mass. So this was a different image of the dermoid, but this was a image of classical dermoid. So dermoid is a hot favorite of NEET PG. NEET PG 2023, NEET PG 2024, and this year NEET PG also, they have given the dermoid. Gutted lesions, bullous keratopathy, Fuchs endothelial dystrophy, binocular vision and simultaneous perception. A was simultaneous perception, B was fusion. This was a pretty easy one, so you could have done that. Orbital cellulitis, true. Ethmoidal sinusitis, most common cause, and a pentacam image was also given. It was a pretty difficult one, as I have heard. ENT, 20-year-old recurrent epistaxis, Holman-Miller sign was positive, nasopharyngeal angiofibroma. Vocal cord extends subglottic, cannot go for radiation. So, and the image was also given of total laryngectomy. This same image was given in 2023 also NEET PG. Recurrent ear infection, central perforation, PTA. The case was of left-sided conductive hearing loss. Nasal trauma, bone fracture reduction by Walsum forceps. Chronic ear discharge, large central perforation. So if it was exploratory tympanostomy, then it will be the answer. But if it was tympanotomy, then myringoplasty will be the answer. 40-year-old recurrent severe nosebleeds, anterior nasal septum. The artery you want to like it is the sphenopalatine artery. Extra was AMA was given, so it was a case of primary biliary cirrhosis. Fatigue, hemoglobin 8, MCV increases and increased, and identify the cause. It was a case of megaloblastic anemia. Another question probably of the crush injury. Two questions I am missing right now, and probably another question on ABG. If you remember any other question, then do let me know in the comment section below. If you want to get the PDF, join my Telegram channel and join my WhatsApp channel. I will share the PDF soon, and if there are any necessary changes required, if there is any mistake in the recall session or any answer, I will try to rectify it and send it to you as soon as possible. So this was all of the subjects recall session, because none of the platforms have done a complete recall of 200 questions. So I finished complete 200 questions recall. So another stats is that 27 of the questions were from my digital image bank and 12 were direct repeat from the FMGE question. So it is the time for you to relax a bit, and जितना स्ट्रेस लेना था वो तो ले लिए, शायद 8 से 10 दिन के अंदर ही रिजल्ट भी निकल जाएगा. सो गो आउट फॉर अ ट्रिप एंड फॉरगेट ऑल दिस. सो आई टुक आउट द recall session as soon as possible so that you can know and estimate that how much marks you are getting and get out of the trap of overthinking. So all the best, and do subscribe if you are new to my channel.